Good evening. Thank you all for being here tonight, and welcome to the Othello-UW Commons and our Louder Than Words series. My name is Christian Love, and I proudly serve as the program manager here for the Commons. I've been in this role since late September, early October. Thank you all for joining us tonight. We first want to acknowledge the Coast Salish peoples of this land, which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. Again, welcome to everyone to our event this evening, and thank you for joining us. To our community members, our UW faculty, staff, and students, and all those who are joining us live today or also via the live stream, I appreciate you all for joining us. And we're very thrilled to host our Louder Than Words series. This is our penultimate speaker event. We have one more coming up next month, so I'm very excited for our guest this evening and next month's event as well. The Commons is a physical space and place-based initiative that's really centered on community engagement and also UW's longstanding commitment to Southeast Seattle communities. So we're certainly proud to be in this space. Our doors have been open since January 2019. We host a number of events and workshops throughout the week and throughout the quarter. This is just one of them, many events that we do host. So I certainly invite you all to please do check out our space. I'm happy to offer tours throughout the week and talk more about the work that we do, and certainly host you all for your future events, programs, workshops, and courses as well. But without further ado, I would love to introduce our esteemed guests for this evening. We have four esteemed great panelists this evening for tonight's Louder Than Words event. So today's title is Nurses Save the Day Again. This is a fitting title, as our panelists all understand that racism is a public health crisis. Prior to and through these past few years, we have all been witness to the disparate impact that the pandemic has had on our communities of color. Patty Hayes, she is in the UW Nursing Hall of Fame with recognitions and distinctions for a reason. She has had a 30-year career in public health policy, advocacy, and development. She has led efforts to address institutionally racist policies and procedures and to lead toward community-led solutions. Jocelyn Thomas is a nurse practitioner who specializes in the care of persons of all ages, and her interests include improving patient-provider communication with African-American patients. She is deep in the work of improving the provision of care for those most in need. Sally Clark understood these issues as an elected official and now understands them as director of the Regional and Community Relations at the University of Washington, where she connects with neighborhoods surrounding the Seattle campus, local governments, and communities all around the region. And finally, Azita Imami, Executive Dean of the School of Nursing, the #1 school of nursing. She leads this effort. So yes, congrats, kudos, indeed. The UW School of Nursing is a place of great intellectual excitement. New knowledge that will change lives around the world is being created and crafted here. She knows that nurses who will be studying here are policymakers, clinicians, researchers, educators, and independent practitioners pursuing their studies here at UW, on UW's campus. Nurses who are doing cutting-edge research are doing their work here at the University of Washington. So tonight and together, this group might help us better understand how we can all join nurses in saving the day. Again, thank you all for joining us tonight. I'll turn it over to my colleague, Sally Clark.
Thank you very much. Can we give Christian another hand? Yeah. Ed, I'm not sure you get the intro job back. I mean, that was good. And we're so grateful for the work that Christian has been doing here in the center, and COVID's really knocked a lot of assumptions about how we do education on their heads, and you've been doing so much creative work trying to figure out how does the center fill the needs for students and staff and the faculty and the community here. So thanks for all of that work. Azita, thank you.
Welcome. Thank you.
Yeah, we're really we're happy to have this conversation today. And for folks who were in here earlier, there was the sort of the reason for being for this speaker series, and Christian alluded to it. But there are, as we were talking about, how do we use the center during this time of the pandemic, of reckoning with racism, of the many pressures in our communities right now, and the team talking about this series, there are a zillion things that are pulling us apart all the time. And there are amazing people in our community who are really taking creative action to try to pull things together and to make us better and to put us on a better path. And so I'm really happy that the group of people that we have here to talk about the UW's new center, but also just the grounding and the why and the where did it come from, really just is such a great nexus for us for this conversation. And so I'll just go ahead and start with the really basic question. I think a lot of us, I'll use myself, so I'll use I statements. I think about nurses when I have a health issue, when my older parents have a health issue, and I don't spend enough time, I think, I'm realizing, thinking about nursing, about the systems that affect nursing and nurses and the patterns that have emerged over many decades. You're helping to launch to do something different, though. And so what is this center, and how did the idea come about?
I think the idea came about during the time that I think that the United States had really reached, in a modern time, they reached the culmination of racism and racial injustice. And I think that we at the School of Nursing, we really, felt that we have to do something different. Because, our programs, nurses are responsible for helping promoting the health of people. So that is, by definition, our responsibility. But I think that, up until now, we have been thinking about, educating, preparing nurses with a mindset, with, knowledge, with skill set. But apparently it has not been enough, because we just faced the worst, tragedy in few years that I think that not only impacts the health of people, but also kill people. That was what I felt, that we are responsible, that do something to more than knowledge, more than skill set, more than belief, and I think that for me, the Center of Anti-Racism, just the step from, promoting diversity, equity, and inclusion, promoting, the knowledge for people to understand, how racism could work, we need to take this step to become anti-racist. And for me, it's to close the gap between intention and action. It's not enough. It just dawned on us, I think that all of us and a lot of my colleagues are here who I'm representing them because during the past few years, they have actually, they made the effort for us to make some progress. So they should be sitting here, and I would like to really acknowledge them. We have Associate Dean for Diversity, Equity, and Inclusion, Dr. DeCastro. We have Department Chair, Dr. Ward. Kalia Williams, our very new help to move the center forward, and of course, Dr. Barrington and very exciting newcomer to our school, Dr. Meller. So I think that this is so important that we really think about that. We need to prepare nurses not only to not being believing in racism, not only having the knowledge about how it is in interplay, but also do something about it. And really go in and become the change agents, because I hope that you all believe, agree with me that our healthcare system is a racist system. And we need to acknowledge it. We need to not only acknowledge it, but also do something about it.
You're taking me in a different direction than my questions, prepared questions wanted to go. I want to stay with that for just a second, because I think there are well-meaning people. I'll put myself in that, we're all well-meaning people, right? I think there are a lot of people who say, yep, I think that's right, but I don't know that they know exactly what that means to say that the healthcare system is racist, that health outcomes prove to be racist in some way. Is there a way that you explain that to people when you're talking with them about why the center and why this work?
Yes, and I would like to say that I am a person of color, and I have both worked in the system, I have educated the healthcare providers, and I have also been a patient. And I am also, I'm with you. I think that it's very difficult because we are all a product of a white racial framework that impacts everything we do, our mindset, the way that we are programmed, the way that we are reacting. So I would like to, quote what my dear colleagues, very new, Seattle Times opinion piece that she really, I think that you nailed it, Dr. Barrington, when you wrote that no one can, have any opinion about it until you have experienced it. Mm-hmm. And you need to really, believe in the experience of the people and really not only experiencing, but really looking and seeing that the seriousness of the problem. We are killing people because of that. Mm-hmm. And this is serious. So Patty Hayes declared that as racism as a public health crisis. I really believe that we should, whatever we did throughout the pandemic, when we got together, worked together to fight the pandemic, that is what we need to do to fight racism in our healthcare system.
I'll press on a couple more questions and then we'll do our swap. So just to let people know, we'll allow Azita to move away and then we'll bring up Joycelyn and Patty. But in this work, do you know yet, I was taken with one of the Joycelyn had a quote in the announcement about the center referencing that the School of Nursing's own walls have promoted anti-Blackness and white privilege. Do we have a sense for the center how much of it is focused internally on UW's school work and how much of it is about broader community work?
I think that we should do both and much more. That is also something that I think that it's very unique with our approach to this center and how it should work, because we have understood and really, agree that it's not enough to do one thing at a time. You need to everything at the same time if you want to, have any results, any impact. And that's why we have to work internally. We have to really interrogate the past. We are doing it. We have to find out and acknowledge how we have harmed people through our policies, through our systems, through our admission, procedures. And also, we need to reach out to really work with the historically, excluded communities that have been impacted by racism. And we need to bring them, and we have to really, climb down from the ivory tower of the academic institution and let the communities tell us how we should, because, it's very easy. We are all, intellectually, I think that knowledgeable and prepared, but we don't know how we should put our knowledge into action. They have to tell us. And that's why we are doing all these things at the same time. We are re-envisioning our curricula. We are, working on policies, or, the way that we are planning budgets and, financial managements. Everything, it's really lifting all the stones and try to do something simultaneously, because that is so important.
And some of this work, if I'm not mistaken, came out of an earlier conversation and an earlier set of actions for the School of Nursing around what does it mean to do an anti-racist budget? What does that mean? So for people,
So
it's a whole other show, isn't it?
It's really interesting because, I myself, like anyone else, always, have this kind of, notion of myself that, no, I'm not a racist. I'm not, I try. But, it was so awakening for me how the decisions that I personally make and my leadership team and, that they could really perpetuate racism. And it's so unintentional because, you don't even want to, it was scary from the beginning when we started to practicing to really, have that approach to our budget planning, to really thinking about every single decision that we make in order to allocate our fund, does it perpetuate racism or not? Does it, perpetuate discrimination or not? And for me, it was so awakening that I am one of the, people contributing to this perpetuation. And then this is a work in progress. Right now, we don't have a clear system, but together with some colleagues, we are working on really creating a framework so that we could systematically, challenge ourselves and our thinking, because otherwise it's so easy, and there are always so many excuses why you make some budgetary decisions that are legitimate. And you need to really shake yourself, and I think that a framework would be helpful. So hopefully we can get there. This is a work in progress right now.
Sounds like it could be a model for other schools as well.
Absolutely, yeah.
The last thing I'll ask you is for the academic insider baseball, centers aren't easy to set up. A center has a particular meaning in the university environment. It makes fundraising people very nervous when we start talking about centers. When this idea came up, did you have any roadblocks that you had to overcome in terms of establishing a center?
Not that, as many as I had expected to. I think that the excitement was and I think that because we were really excited and we really believe that this is the right thing to do, we have to have a platform to really moving from, teaching and researching about racism to really do something about our knowledge and what we educate people to. So I think that we deliberately try to really shake off all the concerns and possible challenges, and we just I remember very vividly my very early conversations with Dr. DiCastro here, that we just said, let's just hold our nose and jump, because otherwise, if you try to constantly, paint all the, obstacles, and we take them as we go, because otherwise we wouldn't. I think that sometimes we get scared about the view of what might happen, and this time we just thought that this is our obligation, we have to do it, and then we would take the problems as we go. And people have been so, all the wonderful, support that we have received within the school, within the university, and also outside. And we are really open. We know that we don't know everything. This is a kind of, it really will take a village for us to make progress, and that is what we are doing right now.
All right, you've laid a great base for the next stage of our conversation. So, Azita, we'll go ahead and dismiss you from our stage.
Thank you very much.
And then
Thank
Joycelyn
you.
and Patty, if we can bring you up. But of course, Azita's not allowed to leave. There we go. And we'll come to Q&A here in a little bit, and everybody's fair game for Q&A. So Azita's microphone will be turned off now, but if we come back to her, we can bring her back up. We'll keep it on you, just in case. Okay, welcome to the front of the room.
Thank you.
Thanks, Allie. And I want to say thank you again for being willing to do this. We had a good prep conversation a week or so ago, and we got to have another prep conversation tonight before this. And then it'll be fine. And what I'm going to ask is for both of you to describe what your relationship to this project is, because it would be good to hear how both of you came to this and what your interests are for it. And we didn't flip a coin backstage. I don't know who would like to go first.
I think you want me to go first.
Oh,
Going with the age. Oh, right.
Just want to be clear, Joycelyn said that.
Yeah, that's great.
Just want to be clear.
Way to start. That's great.
Yeah.
I'm happy to start. Happy to start.
Yes.
Yes.
Leave me room.
Your time will come. I'll leave you plenty of room. Plenty of room.
Before you get started, Patty, this was the most hugging I've seen of any group as we were all milling around and getting ready to sit down. And we've been doing this since October with some huggy people. You all are huggy, yeah. And so I love the interplay and that you all seem to be enjoying this project as difficult as it is. So.
Yes. Well, so thank you, and thank you for inviting me tonight. It's very exciting to be here. And Joycelyn is one of my favorite people, and I love Azita, and Butch is such a great colleague, and I love just everybody. So it's really such a privilege to be here. So I'm a member of the Dean's Advisory Board, and this idea really was something that I felt as an advisory board member was something that we could really grasp and support what the school was putting out as the intention. In addition, the whole conversation started soon after Dow Constantine, the county executive, and I declared racism as a public health crisis. And when he and I talked about making that announcement, we had a deep conversation because it felt like in so many places around the country there was a lot of words happening and no action. I was very frank with him that that was not going to be, if I was going to step in that space, that was not going to be what was going to be happening. So this idea of beginning to figure out how to create an anti-racist budget, the idea of how do you take institutional racism in government and move forward, do something, and really change procedures, policies, the whole way of approach was something that I committed to. And when the school decided to step into this space, I wanted to be a part of it because I'm a proud alum, twice over. And I really believe that nursing is in the spot to really support clients, patients, the community, families. And I've seen over time the effects. I mean, it's clear, the data is clear, being the public health wonk. I have to say the data is clear that approaches that we have taken in the healthcare system are inherently discriminatory, inherently racist. And I believe nurses are the perfect group to lead the way.
And I would, first of all, ditto just about everything Patty said, and I'm just excited to be here tonight to be able to just share some of the work that we're doing and why we're doing it. I would be remiss to say that we wouldn't be doing this work without the leadership that we have here in the room at the University of Washington School of Nursing, and also just the sheer fervor for doing something about this. I also am on the advisory board at the School of Nursing, and also a two-time alum, Patty. And so, but I came to this, I was invited to help to create and facilitate and then listening sessions. It was really important for the center to have a voice from inside the school and outside the school. And we can talk more about that process a little bit later. And I was invited to, based on some of my interests and work that I've done in the community, to be able to do that work. And so through a little twisting of the arm, Dr. DeCastro brought me on, and it's been a labor of love, and so that's how I'm here. I will say, though, that in the height of the social justice movement, the school had a town hall meeting. And I was invited along with Ben Danielson and Frankie Manning to help to facilitate some of that conversation. We didn't really have to do much facilitating, but from that, what was really salient was, as Azita was referring to earlier, is that we have to do something and stop talking about it. And one of some of the dialogue that we had was around, this may not be pretty, it's not going to be easy, people are not going to like it, and it's not going to fit in a box. But we just have to move forward with what we know is right to do. And so that's how I came to this process.
You had me smiling a moment also ago because you said Frankie Manning. Love Frankie Manning. Oh my God. One of the greatest.
Who doesn't?
Oh my God. One of the greatest people. Yeah. And appreciate how many times Dr. DeCastro's name is coming up here. I'll say both Azita and Butch have been such great supporters of the whole project of the Othello Commons that really without your support, I'm not sure that we would have had a project. Really having that energy was fundamental to that, to getting this going. So, okay, you both get involved. Yes, it's going to be messy. It's not something that a lot of other schools have been able to launch. People talk a lot. I'm going to step back for just a moment also to maybe drill down further. And you know, Azita said we have to do all of these things at once. And at some point there's prioritizing and there's explaining to people what are we doing. Are we distinguishing between nurses and nursing? And if so, what are we distinguishing? Is the center about how do nurses get produced, trained, and educated? Is the center about nursing policy, curriculum? Is it all of those things? Or what do you want? Maybe there are differences of opinion. I don't know. What is it? What do you think?
Let me go first. To me, it's all of the above. I mean, nurses are the individuals that are going to be providing the care. And so the investment and the work with those individuals to make sure that we have more and more diversity, more and more nurses of color, so that as patients are showing up for care, they see people who look like them, is just essential. Mm-hmm. Nursing becomes the process. That's where we break down the policies, the procedures, the institutional racism that's occurring that leads to poor outcomes. So you have to me, address both. And so that's why I really supported the broadest type of center possible and the broadest engagement to drive the center with the community rather than what I see most centers doing around the country, which is they start with a leader who has some great ideas and then the community's engaged. This was intentionally flipped. And I think that just shows the whole grounding that you have to address the whole thing.
And I want to be really, I really want to be clear that nurses are, you go to school to become a nurse. Nursing is an art and a science. It's a combination. And so that, and then when we think about how does the center relate to us changing the paradigm of nursing to be anti-racist, we have to, what we're doing here with the listening sessions is we're informing that process, because right now we have lofty ideas. There are lofty ideas that have been put out. There's been a mission, a vision, but that I anticipate will be modified and changed and maybe even thrown out after listening to inside and outside. The inside community, the outside community, because that's really what's going to drive the center to be successful and impactful, not what I think. What you may even get non-traditional ways in which we're used to looking at with our regular trained eye of what something like this and how it should be led. It may look completely different. It may be very, very non-traditional. So we really have to take those things into consideration when we're listening to our community.
So that's a great transition to, and we've referenced this a bit already, but the center is a thing. It has been established, but there's a whole process going on to help inform what gets held within that, what gets held within
Absolutely.
that umbrella. And so can we talk about what's the process that's being engaged in? Why listening sessions? You got a little into that right there, but why listening sessions? How are they being carried out? I know that we're not ready to talk about results of any listening sessions today, but giving some window onto the process would be really great.
Well, the process is pretty rigorous in the sense that you have to take care with each step, but why listening sessions? So most people that do community led grassroots work understand and know that it is imperative, it is absolutely necessary for the community to have a voice in whatever is being thought upon them, erected around them, planned for them, the community. There's been so many examples of where the community was not engaged in the process of thinking about how to do something in that community, and it has failed. And so, but it has been shown that when you hear from your community members, that you have a better chance for whatever it is that you're planning to do to be impactful and successful in the way in which you hope, or not. But it is led by the community and their perspective. So the listening sessions, so when I came on, I have Kalia works with me to keep me moving along. And so we, just got together and kind of thought about how are we going to engage communities of people inside and outside the school. This is not exhaustive. I anticipate that there will be ongoing listening sessions as the center begins and continues its work. But we tried our best to come up with salient groups of people inside and outside of the school. We convened a steering committee. Dr. Barrington, who's here today, is on that steering committee as well. There's a steering committee of about 5 active members, and they help to inform the process of how we would actually conduct those sessions, including the types of questions that we were looking to get information from the community about. We then just, after we, sort of mashed that process around, we then just started scheduling sessions with the groups that we wanted to hear from. And we have over 18 hours of listening sessions. And we have academia, students, and then we have key stakeholders in the community that we that we solicited to come talk with us. So different professional nurse organizations, ethnic nurse organizations, community groups, and people who are actually doing work in the community, and health boards. And so those are the people that were listening, that we were working with to get this information from. And so right now, just in the process of finalizing those results, and we'll be presenting to Butch and Azita next week.
Is there a geographic aspect to that external community stakeholder identification, or is it, you mentioned professional organizations, but are they mostly Washington State, or does it go broader than that?
It was
or?
Washington State.
Yeah.
We stayed within Washington State.
What about the community-based groups? Are they geography defined?
The community-based groups were in Seattle and King County.
Yeah. Interesting. So, and how did COVID play with how you would do listening sessions? Because I think
Zoom.
typically, because like listening sessions, you want to rent out a place like this, and you want to get a bunch of food from someone in the neighborhood and bring people together and have a good conversation. And
Would have been
we've all,
wonderful.
right?
Great.
Yeah, we've all been thwarted in that.
But we actually think that the Zoom was actually facilitated participation, especially with some of the smaller organizations like the health boards. It made it so that they were actually able to attend, where they might not have been able to attend if we were trying to hold something in person.
I don't know if this is specific to the listening sessions, but when you reach out, and maybe this is a better question for Kalia, but when you reach out to the groups and say, hi, we're from the Center for Anti-Racism in Nursing, we want to do a listening session, does everybody say, oh yeah, I totally get that, or are they a little quizzical, and to what degree do you have to explain, we're going to ask you about racism, maybe even for the professional organizations, is it harder with them to say, hey, we want to talk about racism in this work that you are completely dedicated and your life is wrapped up completely in?
Kalia, do you want to answer? Are you?
Sure. I think if we'll get you a microphone. Hold on, Kalia, yeah. And then, yep. And Kalia, will you identify yourself too? Introduce yourself?
Hi,
If you can hold it a little bit, yeah, there you go.
My name is Kalia Williams. So I'm the Project Operations Manager in the Office of Diversity, Equity, and Inclusion. So to address the question, actually when I was reaching out to groups, most people were open and excited to engage. Some were relieved that we had finally reached out and asked this question.
Oh, wow, great.
Some were quite relieved and were ready to answer that question. So it was really easy.
Yeah.
Honestly, I didn't have to struggle to get engagement, really.
Huh.
Yeah.
Thank you.
Yeah.
Yeah, Jodine will now take control of the microphone again. Because that's rule one in groups, try not to lose control of the
She's
microphone.
absolutely right. I mean, people were very excited. We had a script that we developed ahead of time for the outreach, and marketing on the script as well. So I feel it was really well received. You know, as she said, people were very eager. I mean, I think they had a very robust one of the professional groups. And I would be also remiss if I didn't let you know that we had additional facilitators besides myself, because we felt it was really important for the sessions to be led by someone from the community that the participants were part of. So we basically did something that I learned along the way that the School of Nursing actually has been doing for the last year and a half prior to me starting, and that's caucusing, when they're talking about difficult subjects, including racism, and that they have affinity groups where people of the same affinity will be together. And so Patty was one of our facilitators. Kalia facilitated, Sammy Enville facilitated for us, Dr. O'Connor and Dr. Altman. So it was a wonderful experience. So.
That's great. And you're incredibly busy because you have a practice. So the fact that you were able to facilitate is really kind of stunning as well. You're retired.
Retired, yeah.
I don't know what you do with your
Yeah,
time.
that's right. Yeah. I get none of that. Yeah, she's like 3 full-time jobs.
So let's step back again, though, back to the sort of focus question of the center, and I think to a more general sense, you've got some folks who they were ready for this question, they're ready to engage, they're excited for the center to be able to help to take action, and then there are going to be some other folks probably outside of these circles who are going to say, how is racism manifesting in nursing? And how do I see that? And Dean Amami, you were very clear in your language. There are things about the way our system works that you said kill people, allow people to die, because we are approaching things in ways that don't work. So for nursing, what if you had to explain to somebody, like, how is racism manifesting? And is it in the health outcomes? Is it in the disparate health outcomes? Is it in who gets to be a nurse? What?
Patty, okay. Wow. So, this is probably a whole 3 shows times 2 series, okay? And I say that because, you mentioned, how does it manifest itself? Does it manifest itself in the procedures, the way we give care? Does it manifest it, how many people get into school? It's all of that. But if you just want to know, people say, well, racism, how could it possibly exist in nursing? This is why I have my book right here by Dr. Lois Price Spratlin. And if you ever want to know, how does racism manifest itself? You read this book, 26 Stories of African American Registered Nurses in Seattle, The Struggle for Opportunity and Success. And there will be no question. Because just in telling their stories and just their lived experiences, it is illustrated clearly. I think that there was a group, I think it's called don't let me forget, it's the Activism Think Tank in Nursing. They started like a group. They started talking with one another, and out of that, and when COVID started, and then the social justice movement started, these nurses all over the country got together and created something really special. They started off just talking, and they called it, the time that they got together and talked, the title of it was Reckoning of Racism, the Reckoning of Racism in Nursing. I'll say overdue reckoning.
The overdue reckoning.
Of racism in nursing. Yeah. And what a powerful group, because from that group meeting for a year and a half, it was Black, Indigenous, Latinx, and other nurses of color that got together and told their stories. They realized that this is powerful and we need to put this on a platform. So they put together a web series just this last year that they finally published. It's 4 sets where they talk about the lived experiences of these nurses and how racism shows up in academia, on the floor, when you're trying to get into school, when you're trying to get tenure. I mean, their stories are incredible. And could be anyone's story who is a nurse in here, color. So when you say that, I'm giving you that answer because I can start from here and talk to you for days and talk about how racism shows up in nursing on many levels. But as if someone naive to it said that to me, that's where I would start.
What I would add to that is an organization will seek to maintain its own equilibrium. So a racist organization, even as things are brought up, it's naturally going to seek to stay the way it is. And people do that. So as a white woman, one of the things that I felt was very important to me as I was learning on this journey was this issue of stories. I've always, when I worked in government relations, you know this, stories are really important. Data is good, and stories are what make it real. So I think in terms of public health, one of the things that public health has struggled with over time is the data is there, but if you're not being with the community, if you're not paying attention to the stories, if as a nurse I'm not looking and listening to the folks who I am working with, caring for, then I'm going to stay in a lane and be assuming things and acting on things that will reinforce the racist policies, the racism in the. So to me, the more we can support bringing these stories up, and for me, talking about my path, my story, and particularly with other white colleagues, really standing in place, supporting Azita, supporting Joycelyn in this work is essential. I felt that, and it has been documented very clearly, that white people will function, and you've seen the information on white fragility, we function and we don't speak up, we don't step up, we don't act. We let others tell the story, and that's got to turn around. And we've had some interesting conversations on the advisory board about this. And when I'm functioning on that advisory board, I am actually listening to my colleagues of color to see where I can step in and not just be an ally. I want to be a co-conspirator. That's what I want to be. Because things are not going to change if we don't listen to those stories, understand how it's manifesting, look at the policies under it. And there's going to be people that disagree, but if you start changing the system and supporting it as leadership, you kind of run over those people eventually because well, not everybody comes along.
You know, I think Azita said something very poignant, and I'm not sure if we were, you know, and she said something about we have to do everything simultaneously. And I think that one thing that, if nothing else, COVID taught us is that you're not going to get anything done if you just don't run with like 20 people running at the same time to get it done. Because you don't have time for bureaucracy. You don't have time to like, oh, let's see, did you get the pie chart? Do you have this? No, we just do it. And we figure it all out after we get there. Because it's drag, it's too much drag. You've got to, in order to do something, to get things done, you've got to just run forward. And I think that, and I'm going to stop, I'm sorry, Patty, I was just also going to say, to your point about listening in the stories, is that I am not beyond reproach. I have my own biases and my own film over my eyes. But that's why it's important to me to hear stories, because I have been through this process, through other processes of being in focus groups and et cetera. I have been surprised myself that, wow, I didn't even realize I had a lens on my eyes over with regards to X. So this is a really important process that we're going through.
I'll note that we can take questions at any time, and the way we've been through a few iterations of how we do questions in the room. What we're going to do is, if you have a question, go ahead and raise your hand, and Fran is going to come around with the microphone, and you'll get to ask your own question. We used to have you write them out on cards, and so we've stopped with that. And so just flag if you have a question or if you have a comment or something that you want to pose as a part of the conversation. And then Fran will come over with the microphone.
Can I then, while we're
Please.
doing that, give another example? One of the reasons why I was so excited to step into this project was when COVID hit, there was a moment that I called Azita, and we were in a crisis. It's a story. It's a story of just going for it. So we were, of course, with Life Care and happening here and in a crisis mode. We were trying as public health to set up this infrastructure as fast as possible and breaking down every barrier. We were trying to get forward, and one of those was setting up a call center and how we increase staffing. And when I called Azita, I found out that the school had lost basically all of its clinical placements. And so I said, how about we get together and we talk about it? And she leaned in immediately. And not only that, she brought her leadership team. I drove to the university. We were still meeting together at the time. It was before masks. It was really early on. And it was at that meeting that catalyzed a partnership that gave me the confidence that we're going to tackle all these things together at the same time. And not only that, I think that we, in our work together, saved that class, allowed that class to graduate on time. And that might not have happened. So it's another example of just I love your image of just dragging 20, I think that's what we did. We just drug everybody along. And to have the county turn on a dime, like all the thing, I had wonderful conversations with our attorneys. I really did. It's all good, it's all good. It all worked.
You did what? Nobody indemnified who? What? Yeah.
Again, thank you all. Love the stories, love the work you all are doing. I have a question for all three of our panelists, a couple of small questions. One, Azita, you mentioned some of the key stakeholders, collaborators. You mentioned a village. Would you mind sharing who some of those key collaborators or stakeholders have been, either internal or external? And then my second question is, for all of you, whoever wants to answer this one, and thinking about access to nursing, really diversifying our nurses within the state. You all have a current funding plan in place to help with the access piece for low-income students, students from marginalized backgrounds who are seeking funding for School of Nursing.
I think you should, yep. Would you guys like Azita to use the handheld mic, or do you want to turn on, handheld mic is good? Great, thank you.
So I will also ask for help. Bush can help me. I think that the stakeholders, the people that we are engaging, it's really everyone that we think that might have something to contribute, and also they think that they could. So from students, faculty, staff, they are all engaged internally. We have conversations with other schools within the university, and also externally, as Joycelyn also shared, that we really try to reach out to various organizations, individual people, our advisory board members are engaged. So we really try to make it as really a village, and really knowing that every single person stepping in and sharing their thoughts and ideas, it matters for us to really, learn something about it, and also open our eyes, wider for new ideas. We really need to, understand that we don't have all the answers, and for this to be have a great result, we need to, engage everyone. About access, that is a very good question, and it goes back to financial, anti-racist financial decision, because prior to all these things, we for example, had, the system in which we, and distributed our scholarship, for example. It was really not very strategic and thoughtful. I constantly, understand that in academia, we make a lot of decisions in silos. And we don't connect those dots with each other, so that even though we have an initiative like that, we might make decisions that could be directly, counterproductive to this. And that is why we constantly need to talk with everyone, because it's very difficult. And so for providing access, we looked at the distribution of our scholarship. We tried to change that so that we really provide more funding to students from historically excluded, communities. We also thought about how we can even, plan for our fundraising to be also helping, leveraging our investment, financial investment in this. And then also thinking about in this time of COVID, for example, time of pandemic, when we could, think of all kinds of, financial needs, to really make sure that this is what we want to invest in. And really showing, because I think that the money is not only about that you really provide those resources, but it also sends a message. When people hear that, the School of Nursing, despite all the financial challenges that we have had, we still decided to spend, a good portion of our fund to really, move forward with this. We decided to reorganize our scholarship, structure, so that we absolutely think about who are the people that we, that we need to bring in. We have done a wonderful job in really, again, reallocating money to create a better startup packages so that we could, hire from communities of color or unrepresented, communities. So again, there are so many components that we try to do at the same time. And I really think that if one of them are missing, we are not going to be able to make that progress that we are doing right now. We have just launched a PhD Dream project that is also very important for us, because, if we don't have enough PhD graduates, we cannot educate more nurses. So this is so important. And if we say that we want to hire, from diverse, population, if you want to really also be able to teach our students, that those role models would come in and teach, then we need to invest in PhD, growing our PhD. So this DREAM project is really about to provide full scholarship for all the PhD students. If they cannot afford it, the money shouldn't be a barrier for them to pursue their PhD program. And that is a dream that we have. It's a very bold dream. We need a lot of money. But we just said we hold our nose and we jump in and we launch this. And doesn't matter if we don't have $188 million of endowment tomorrow, but we will get it. We have waited too long. So that is our way of providing access. Bush, do you want to add to it?
Yeah, maybe just to the first part. I would just say in terms of, the folks that we are considering as stakeholders is at this stage, it's not even just about listening and hearing from them, but establishing a relationship for the things that we're going to do from this point forward. And so really looking at them not as stakeholders, but partners in the work that we're going to pursue. And so to the extent that we could establish that trust and that rapport, because this is not something that the School of Nursing is going to do in isolation.
Right.
It's going to really require everybody joining in together in whatever space they hold, whatever position they hold. And so that's how we see this thing. And so that's the long view for sure. Yep.
Let me ask, we've got a question, yeah? I will wait on my question. Go ahead.
I'm going to ride the wave or continue to pull on the thread about partnership first. Really excited to be in this space exemplifying the desired partnerships with community, but also like exemplifying the partnerships at the University of Washington and the work that's happening there. So I want to acknowledge, one, the DUB, in my eyes, is like the anchor institution for our region. And I know we're speaking specifically to the nursing arena, but we're also talking about workforce development. From the global health lens, right? Like this is a piece of that, this lane is a piece of that tapestry. And so I'm curious to know for the center and for the school overall, what is the thought process with regard to like what role the center will play and the nursing arena will play in the overall landscape when it comes to families here in the greater Seattle area being able to thrive and stay in place. Thinking about it in the context of, I think you mentioned like development, right? The built environment. And so where do you all see yourselves in that continuum and contributing to the overall picture? If that didn't,
Yeah.
I don't know if you need, yeah.
It's a big question.
It is a huge question. And
It's appropriate for you to
yeah,
answer.
I would say that what you just described is the wave that I hope that the center will start creating. The methods that are being developed, the way the community will shape the center, it will exemplify something that's new. It will change processes. And then what I expect to see, which in change management is you have early adopters. There will be some who will gravitate to a new paradigm and begin to pick it up. And then you'll get more questions and more modeling, and we will create more and more energy through that. I had the privilege, through Azita's invitation, to speak with other of some folks here to the deans of the health sciences. Now, whether or not they work together or they figure things out for themselves, just being able to be in the space with all of them, for me to be able to say to them, being outside of the university, how I see their opportunity to lead the way as the health sciences of the University of Washington, and lay the groundwork and, frankly, pressure so that they will continue to to see how they can move it forward in their own schools. Because somebody's got to step into the space boldly, I am expecting and very hopeful that the trail will go through the uncharted territory here, and then people will see it as easier to follow.
So with that, we are just about at 7 o'clock. The hour flew by. There are pieces of this that I wish we could have gotten more into. I want to.
We'll come back.
Will you? See, that's great.
Volunteering.
I'm volunteering, Joyce.
I'm going to share, if it's okay with you, again, before this, we did a quick poll of where people started their nursing career. Patty, you started?
My first job was at West Seattle Hospital, which is no longer a hospital, on the med-surg floor.
On the what?
Medical surgical floor.
Med-surg, you know.
Med-surg, inside. Yeah.
Joycelyn, you started?
University of Washington, high-risk labor and delivery perinatal unit.
Butch, we had you.
The operating room at UCLA Medical Center.
Operating room at UCLA Medical Center. There you go.
Operating room at the UCLA Medical Center.
Dina Mami?
Geriatric care at Karolinska Hospital in Sweden.
Yeah. It was just such an interesting spread, and when we named this tonight's panel, we were like, what are we going to call this? What are we going to call it? And the truth is, most people think about, okay, nurses are fixing it again. And so Nurses Save the Day, again, was meant a little bit tongue-in-cheek, and yet very honestly, like this is a project that is seeking to really get at something important, and I really appreciate that you all have been willing to share some of it here tonight. And we probably will ask you back in the future at some point to talk about, okay, here's how it started, how's it going? And we just are very grateful that you were here with us tonight. Before we close, I'm going to say for folks, we have the last of this series happening next month, the second Wednesday of next month, here in space again. We'll have Donald King, Donald is a local architect for people who don't know him. He has been a professor at the University of Washington's College of Built Environment for a long time. And he's part of something called the Nehemiah Initiative, which is a group of black churches in Seattle that are trying to crack the conundrum of how do the congregations support themselves and contribute to housing and anti-displacement measures in the Seattle area. It's a fascinating project. They've done some really incredible work. It ties together history, displacement, the future, urban planning. And so that should be a great conversation next month, and we would love to have you back. With that, I will also thank our UW Video folks here tonight. Thanks to Christian and to our guests again, and we will go ahead and sign out of the live stream. We try to be really intentional about that now. We had some trouble with it early on.